Hi everyone, my name is Mario Maroni, I'm Italian, I'm a physiotherapist, but I'm also an expert in holistic therapies. I want to present what I'm doing in this clinic in Putney because I think it's a little bit different than what you may have experienced today. I work in a very peculiar way. First of all, I check everywhere. So I don't mind where is the pain. It may be on the foot, it may be on the lower back, it may be an headache. It doesn't really matter. I will check everywhere because there is a behavior that you today will learn how to check on yourself, which is there and sustain the problem. This behavior is your body has an incorrect posture. Now, you heard posture many times, and you think if you are sitting on your desk just by keeping your spine a little bit more straight, you can improve your posture. It will last 3 seconds. What brings me to explain a little bit more is this explosion of devices around internet that help you with your posture. This strap that you put and keep your spine straight, the foam roll, all these kind of exercises that you will need to do forever just to have a relief from the pain. If you stop, the pain returns, you know. But even if whatever you tried before, it worked, and you stay, let's say 1 year pain-free, the pain will return if you don't address it, you don't make a specific evaluation of what's going on, and when it will return worse. The MRI and X-ray will be then positive at some point, but what's going on in your back if you have a lower back pain? What's going on in your wrist if you have a carpal tunnel, or on your foot if you have a plantar fasciitis? They don't work properly. For the foot is a little bit different. You more likely put more weight on it. So if you have a bagno, you put more weight on the front part of the foot. But if you have a carpal tunnel, just look at the tendon. Just make a fist. Look at the tendon. They are not straight. They are not straight. They should be completely straight. They are not straight. Some people, they have this tendon here. They are on a side completely. Obviously, you will have pain because the carpal tunnel, which is a space in between tendon, in between vessel, in between fat pad, it's not working properly, it gets inflamed, and you get the pain, the usual pain. How to make those things more straight, you understand very quickly. If you look, if you acknowledge it, you will understand that it's not a problem here, it's a problem of posture. Now, if I do some test on you, on the shoulder, if I ask you to twist right and left, you will see so much difference side by side that you will start understanding, okay, what I can do, very little. You can try to do exercises, you can try all these things that everyone advises, but why you're still in pain then? And why for a carpal tunnel, for example, there is just the operation? Or why the lumbar spine pain, no one expects this pain to go away, just to self-management. There is a reason, because no one is checking how it works. Is it true? Your spine is twisted, 100%. Your pelvis is twisted, but believe me, your neck, your single finger are twisted. So if you start doing tests, left and right, the leg, the hip, internal rotation, external rotation, you will see and you will feel a difference in between them. Why? Your body lost an alignment, but why? Where is the problem? The problem is to be found on your past medical history. It's not uncommon to treat a shoulder pain from a calf. You are a runner in England, lots of runners. If you're a runner, lots of people, they run, but they play sport in general, they have calf injury. You don't even know. Do a check today, now. Just lie down and ask someone to take your foot and move it backward. Dorsiflexion of the ankle. Let's say this is the tibia, fibula, and this is the foot. You do this. Does it move like the other one? There may be an injury. It's not a problem here because you already understand if the foot doesn't go backward, for example, every time you make a step, the foot should go this way. It doesn't in your case, so you put more pressure on the other side, which can explain why you have a pain on the knee on the other side, but it can explain a pain everywhere. Why you can have a pain on the shoulder? Because the foot injury, the ankle injury, will make a chronic restriction on your spine. Same side, on the sacrum or on the lumbar spine, depending where is the injury. If it's on the foot, it will be a little bit lower down on the pelvis. If it's the leg, it will be on the lumbar spine. So the lumbar spine will arch this way, will twist. Your rib cage and your shoulder will lose the balance, and you won't be able to move the neck left and right equally. Sooner or later, you may have pain on the neck, on the shoulder, headache from a calf. You won't believe I have patient who improved after one session. You won't find your case on Google. You won't find your case on YouTube. What I'm trying to teach you is that your case is not the same. Past medical history is unique, is yours. You may have a fracture on a toes, or you may have a cesarean, which is extremely frequent. The cesarean make a mess on the lumbar spine, okay? Every time you have a cut, there will be an irritation on the spine. If you have a cut here, there will be an irritation on the neck. Right side, if you have a cesarean, you will have T12, L1, L2, completely locked. Try, just try. Lie on your back and ask your partner to go underneath this area, lumbar spine, and try to move the spine on a side flexion. Try to grab and move it right to left, left to right. You won't be able. There will be that spot around here which doesn't move sideways. You have an hernia, it will be similar. It will be similar because the irritation will be still T12, L1, L2, more likely, but also the leg, it will be a little bit more stiff on that side. Inguinal hernia I'm talking about, okay? You have an operation in the eyes. The eyes has an immediate connection with suboccipital muscle. This part will become very stiff. You can end up with pain on the neck, but you can have pain on the lumbar spine. The body has an intrinsic motion. So if I put my hand here, I will feel movement. That movement has to be rhythmic. Whatever it is, you will be twisted. That body, it will not be rhythmic anymore, and where there is no rhythmic motion, there will be an injury, which you will confer. Usually the injuries which are more important are the ones that happen in your childhood. So you can have a bang in your head when you were 2 years old. That's incredibly important today. And by one treatment on that injury that happened maybe 30 years before, you may feel the improvement on the lower back or on the foot pain, because you will gain back an alignment. So forget you can improve your posture. Okay, these people let you lose time, and time is very precious, because then if the posture is still misaligned and you need 3 minutes to find out, if it's misaligned, over the time you will have the disc problem. Over the time you will have the knee cartilage destroyed. Over the time you will have the tendon damage. These things, when they happen, they were preparing the condition for decades. So you may have the spine twisted for 20 years, and then one day you lift a weight and you stay blocked for days, unable to do anything, and then your life since then may be completely messed up. You may lose your job because maybe you have a manual job. You may lose your house because you cannot pay your mortgage. So it's extremely, extremely important that today, even if you have no pain at all, you check yourself, and if you find something, you can come here and I will resolve in a matter of 1, 2, 3 sessions. My treatment is extremely light. There is no contraindication, so it's suitable for any age. You can be with any pre-existing condition. It doesn't matter. I will release in a way that your body wants to release. If you crack a bone, let's say I want to crack a bone. I crack my finger. Now they move more. Yeah, they move more. In 5 minutes, it will return crackable. Why? Because they return in the previous stage. It's a recidiving. It's a recurrence. Nothing happened. So if you go and crack your bone and crack your bone and crack your bone, don't you understand that it's not working? You don't need to manage the condition. Don't waste all the money on that. Don't waste all the money. You need to have a specific assessment which is yours. You won't find it on Google, you won't find it on YouTube. Stop listening to general advice or 5 tips for lower back pain. It doesn't work. And if it works because you're losing time. It is worse. If you have an injection that lasts 3 months, you lost 3 months of doing something for your pain. It will return 100%. No one created any drug, anti-inflammatory and painkiller, to sort problem. It's a management. It's a management. No one give you this kind of drug to sort. It's just a chemical. They shut the pain chemically, but sooner or later it will return. So we need to understand what's going on and how beautiful it is when you just lie on a bed and someone, without knowing anything, is able to tell you, here there is a restriction, so you had an injury here there is another one, probably you had an injury here, and then we work on releasing them and making your body properly functioning. Thanks for watching. If you want, send me an email, bodyoptimus@gmail.com.